So now I'm directing my talk to our friends, colleagues, ladies and gentlemen who are non-Arabic speakers. It's been 2 weeks since we've met last time. And in these 2 weeks, unfortunately, a lot of things happened. And let me start just by what's happening internationally. Up until this morning, there are 38,752,824 cases of confirmed cases of COVID-19 worldwide. Of course, this is an underestimate. We know that there are many countries, unfortunately, they don't have the facilities to report, they don't have the resources. The reported deaths worldwide, 1,100,823 cases. Let me use what I used in Arabic to just ask you to imagine that number. I do occasionally watch football when I have time. If you imagine a football stadium which can take 100,000 individuals, 100,000. Imagine there are 12 of these big stadiums full of dead bodies because of one disease, COVID-19. I think the picture is very, very sad, gloomy, but very clear that this virus is real, that it is causing death, misery worldwide. It ruined everything in our lives, the economy, the health, the social life. Let me come to what's happening in Oman. Again, since we've met last time, unfortunately, we crossed the 100,000 cases. Yesterday, we had confirmed 520 cases, which took the total in Oman to 108,296 cases. Those who recovered so far, 94%. And you will notice that the percentage of those who are recovering is becoming less and less. The reason for that, it's not because the disease is becoming more severe, but because the number of new cases is increasing, and we know that for patients to recover from this virus, it can take anything from 10 days to weeks and weeks and weeks. Also, unfortunately, we crossed another number. The number of deaths in Oman exceeded 1,000 since we met last time. Yesterday, there were 8 deaths. The total is 1,070 deaths in Oman. Any death is a tragedy. Let us think about these numbers not as just numbers. Each individual of those who either in our ICU, which I will mention briefly, or passed away, they have beloved ones, they have families. Some of them are the supporter of the families. So it's a tragedy. One death is a tragedy. 1,070 multiplied that to see how difficult the situation is in Oman and worldwide. Yesterday, 77 patients admitted in our healthcare facilities in Oman, which took the number to 556. And this is, I think, also almost a record for us for one disease. Those who were admitted to intensive care units yesterday, 14 patients, which took the total to 216. And last week, unfortunately, our critical care admission was 220, which is the highest record in our history in healthcare in Oman. Out of the 216 patients who are in the ICU and the intensive care units today, 147 are on ventilators. That means they are very critical. Very critical. You are aware of the decisions which are taken by the Supreme Committee last week. And we were all hoping and praying at the Supreme Committee and the country that we will not resort to such actions. But I think the numbers are very clear. All of us are responsible. All of us are together in this. Unfortunately, we banned gathering in beaches. One of the first decisions was taken by the Supreme Committee not to allow gathering anywhere. And that decision is still, by the way, not reversed. So it's illegal to have gathering in any places, farms, public places, wherever, closed places. The number of weddings that we hear about, and funerals, unfortunately, where people are in tens or hundreds. It's so difficult to imagine that why are we not doing what we can do to minimize the risk to our families, our society, our country. Our staff in healthcare are doing an excellent job, and I'm grateful to all of them and thankful, but they're becoming exhausted. Imagine if you have to wear all the overall for 8 hours in ICU. And today, I brought one of my doctors here, Dr. Anas. He's in his 30s. He was in intensive care for 5 weeks. So the death and the cases, severe cases, are not limited to the elderly and those with chronic diseases. We lost people in their 20s, in their 30s, in their 50s with no prior diseases. How much can we wait until we start doing the right thing? How much can we wait until we think before we go to parties, before we stop wearing masks, before we keep our physical distance from people who are not immediate families? It is the responsibility of each one of us, not only to look after themselves, but also to help us looking after each other, and to report those who are violating the decisions of the Supreme Committee. I have my colleagues from the Oman Royal Police here, and I'm grateful to the work they are doing. They are working around the clock. Do you think we'd like to have curfews? Do you think they've got nothing else to do apart from patrolling the streets to tell people to do the right thing? No, they have other duties. Our healthcare system is reaching a point of, unfortunately, not being capable of managing COVID. Forget about other diseases. There are certain health programs which are sacred to us in Oman and everywhere, and I can assure you that they are continuing: vaccination, mother and child health. But there are so many operations, elective operations, which are cancelled, so many patients who cannot, and we cannot provide them proper follow-up. That doesn't mean they are ignored. We have ways of dealing with it, but not ideal. We have virtual clinics, we have the call center, and I'm grateful to my team who are working there to advise. But help us to go back to semi-normal. As yet, we don't have dates for the vaccine. As yet, there is no medicine that can cure this disease. Oman joined the International Coalition for Vaccine, COVAX, and we will get some when it becomes available. But also, we need to be very careful. We will never allow any vaccine that has not been proven to be safe and effective. But we do have bilateral meetings with companies which are producing vaccine in addition to being member of the COVAX. And we are very proud that we were one of the few first countries to join this coalition, which now includes more than 170 countries. And what it means that whatever vaccine produced, WHO will distribute it equally to the countries that according to their need and not according to their income. And this is a noble cause that Oman very proud and happy to be part of. And from here also, I urge other countries who have not joined to join. I said it before, none of us is safe until all of us are safe. So there's no point of protecting your country only or your society, because this virus will come back to you if we don't protect the whole world. And that's why the challenges for vaccine are huge. There are 7.5 billion persons in the world. I'm not saying we need to vaccinate all of them. No country will do that. But still, we need huge number of doses, and that is not happening very soon, unfortunately. So what I would like all of you to do is to protect yourselves, protect your family, protect the society, help us to keep our healthcare system running safely, help us to reduce the stress that our staff in the healthcare system and other partners are facing. And it's honestly doable, it's easy. Wearing the mask properly and appropriately in where you cannot keep the physical distance, avoiding crowded places, avoiding closed places as well with others, regular washing of the hands or using sanitizers, all are doable and easy. So please, for your sake, for our sake, for Oman's sake, do the right thing. Thank you very much.